Narcotics, opioids, and painkillers, all of which are synonymous with each other, are all names for drugs that relieve physical symptoms of pain. Opioids are analgesics, which are drugs that relieve pain, and the pharmacological effects of them are explained through biological factors. When an opioid is taken, consumed, or injected, it activates opioid receptors in the brain, which blocks the transmission of pain to the spinal cord and to the brain. The opioids act as the brain's natural painkiller, endorphins, preventing the perception of pain. There are several types of opioids that act as pain relievers, whether they be naturally occurring, synthetic, or semi-synthetic opioids. The most popular that are used, misused, and abused are codeine, morphine, heroin, oxycodone, hydrocodone, fentanyl, and methadone. Pause the video to get a closer look at each one. There are many physical and psychological side effects that occur when taking opioids. Individuals may feel drowsy, confused, nauseous, and constipated. In some extreme cases, when opioids are being used and abused, people may have difficulty breathing or respiratory depression, the inability to urinate, and have low blood pressure. Some other bodily effects that opioids have on people involve the intense feeling of pleasure created in the brain, increased risk of pneumonia in the lungs, as well as the lack of oxygen and buildup of carbon dioxide in the blood, leading to slowed breathing and death. They can also cause heart infections, digestive system issues, bone and muscle pain, as well as collapsed veins when the drug is injected directly into the bloodstream. Some other effects also include liver infection, cancer, or failure. The abuse of opioids can also make people feel depressed. When someone is addicted to opiates, they may often have trouble sleeping and may also socially isolate or withdraw themselves. The main reason people get addicted to opiates is due to the euphoric effects that are felt when they are taken. They are often taken to relieve physical pain, but people with poor mental health will often be more likely to abuse them because of the happiness and contentment they feel when they take the drugs. The risks and consequences involved in opioid use are the side effects previously discussed, physical and psychological dependence, the misuse and abuse of the drug, opiate addiction, and possible overdose or hospitalization, as well as death due to the overdose. In the year 2020, 48,006 people died overdosing on synthetic opioids. 10.1 million people misused their opioid prescription, and 1.6 million people had an opioid use disorder. Treatment of opioid abuse can involve therapy, hospitalization, or inpatient care, but there are also drugs that are used to block the withdrawal symptoms and effects of opiates. Methadone reduces cravings and withdrawal symptoms by blocking the opiate effect. Naltrexone blocks the euphoric feeling and sedative effects opiates produce. And finally, buprenorphine suppresses the cravings of opiates when they are not being taken.